federal government issued a rule that U.S. hospitals post their prices clearly, but three of Las Vegas's biggest hospitals are not completely in compliance. Rachel O'Brien from OpenTheBooks.com joins us live to break it all down. Rachel, tell us what the federal pricing rule requires of hospitals and how the majority of hospitals are falling short.
As you mentioned, hospitals are required to post their prices. They have to post a price estimator tool where patients can search for specific services and get a price estimate. They also have to post a very detailed standard charges list for everything that they provide at the hospital, including costs under specific health insurance plans, which can vary greatly. We worked with an organization called Patient Rights Advocate. They put together a detailed report where they analyzed hospitals all over the country. They found that just under 25% of hospitals were in full compliance. We see a lot of hospitals have some version of compliance. They have the standard charges list and the price estimator tool, but they don't have all the details required. And this is obviously important because health insurance, or health care rather, is very expensive. And about 100 million Americans have medical debt.
Wow, just under 25% of hospitals. Which hospitals did you look at and what did you find?
So we looked at Mountain View Hospital, which is missing 5 out of the 10 pricing components that are required. They do have that price estimate tool and a standard charge file, but the file's incomplete. It's missing pricing information. So some patients are not going to be able to get accurate price estimates. Sunrise Hospital Medical Center, you also just mentioned in the segment before, they were missing 2 out of 10 pricing components. And then finally, we looked at University Medical Center of Southern Nevada, UMC. They're missing also 2 out of 10 pricing components. Again, all of these hospitals have the price estimates tool and the standard charge file, but it doesn't have everything listed. Some are missing insurance plans. So there's still work to be done to get a complete picture of what all of these procedures cost at different hospitals.
Well, Rachel, final question for me. What did these hospitals have to say about the findings, knowing that their tools are inadequate?
Yeah, so they all pointed to the fact that they do have these things on their website and patients can review them. UMC was very willing and interested in striving to ensure the accuracy and comprehensiveness of their file. And they said their IT team is currently developing a new version with additional data. A lot of hospitals, including Mountain View and Sunrise, pointed to the fact that the Center for Medicare and Medicaid Services, they're the ones in charge of monitoring and enforcing this rule. They've only fined 2 hospitals in Georgia, but that doesn't mean that all these other hospitals are compliant. Hospitals will point to this and say, look, we haven't been fined. But actually, the Inspector General of the Department of Health and Human Services is looking at CMS to make sure that they are doing their job in monitoring and enforcing, because they haven't been aggressive in going after hospitals that are not complying.
Rachel O'Brien with OpenTheBook.com, thank you so much for joining us this morning.
Thank you.